Welcome to part 6 of this series of slideshows that describes the mammalian stress mechanism that was predicted by Hans Selye. This presentation will discuss the shortcomings of conventional hemodynamic theory as a prelude to introducing the capillary gate component of Selye's mechanism. Conventional theory presumes that autonomic balance governs combinations of cardiac power and muscular vasoconstriction to regulate cardiac output, blood pressure, tissue perfusion, and athletic performance, so that exercise conditioning causes the heart to grow bigger and stronger, and blood pressure is directly related to cardiac output and tissue perfusion. However, the idea that cardiac work is opposed by vasoconstriction implies that hemodynamic physiology is inherently inefficient. Essential hypertension, which increases cardiac work, causes progressive cardiac damage that ultimately results in congestive heart failure. Simple observations suggest that cardiac efficiency rivals electrical superconductivity. The human heart consumes less energy than a 40-watt light bulb. It can increase its output more than tenfold during intense exercise despite negligible changes in size or weight. In trained athletes, blood pressure remains normal during exercise and abnormally low at rest. Blood pressure normally declines well below awake levels during healthy sleep. Most mammalian hearts weigh less than 1% of total body weight, and they cannot pump blood more than a short distance in height, which explains why perfusion-dependent mammalian brains are located close to the heart and only a small distance above it. The giraffe requires a disproportionately gigantic heart. Anesthetized patients suffer serious risk of ischemic brain damage if they are placed in a sitting position. Conventional theory cannot explain atherosclerosis, which appears first at bifurcations and greater curvatures of large arteries close to the heart, but rarely afflicts small arteries and arterioles located distant from the heart. It is accelerated by age, sedentary lifestyle, diabetes, hypertension, chronic disease, emotional stress, and both hyperthyroid and hypothyroid metabolism. It is retarded by exercise, moderate wine consumption, anticoagulants, coagulopathies, and Down syndrome. Brain-damaged, bedridden patients often survive for years without developing atherosclerosis. Anemia inhibits both atherosclerosis and coagulation, while polycythemia accelerates atherosclerosis and exaggerates blood coagulability. Efforts to explain these confusing observations in terms of lipoprotein effects or pipe flow dynamics have proved futile. Hemoglobin encapsulation distinguishes vertebrates from invertebrates, but its purpose remains unclear. It does not enhance oxygen delivery, and mammalian red cell mass is far greater than necessary for effective oxygen transport. Furthermore, vertebrate classes are characterized by unique blood cell morphology. Mammals evolved directly from reptiles, but reptilian red cells are large, elliptical, and nucleated, whereas mammalian red cells are tiny, biconcave, and enucleated. Mammalian red cells are so closely similar among species that only an expert can discern the difference. The nature of blood pressure and Korotkov sounds remains unclear. Conventional theory assumes that blood pressure is directly related to cardiac contractility. Were this true, then the pulse would appear simultaneously and equally throughout the arterial tree with the onset of each ventricular contraction and promptly disappear when the ventricle relaxes, for blood, like water, is incompressible. Instead, the pulse appears as a turbulent wave during diastole when the heart muscle is in a state of relaxation, and blood pressure measures higher in small distal arteries than in large proximal arteries. The turbulent wave moves rapidly from the heart to distant parts of the arterial tree and generates lateral forces that are measured as blood pressure. Red cell mass, temperature, and arterial bifurcations all affect the turbulent wave. Regardless of how it is measured, blood pressure does not reliably correlate with cardiac output and tissue perfusion, and blood pressure measurements are similar among mammalian species. Conventional theory cannot explain how the left ventricular assist pump produces effective cardiac output despite the absence of blood pressure or pulse. The Hagen-Poiseuille equation is the classical description of the relationship of flow and pressure in pipes and arteries. Unfortunately, it is based on the false assumption that fluid flow in pipes is so-called laminar flow that is free of turbulence and flow friction. A common example of turbulent flow friction in water pipes occurs when water faucets in old houses are opened suddenly, so that water flow accelerates rapidly, causing severe vibration that is accompanied by sharp reductions in water flow and the appearance of debris that is dislodged from the inner surface of the pipes. The Hagen-Poiseuille equation cannot explain this phenomenon, and it is accurate only at extremely low flow rates. These examples should illustrate the need for improved physiology theory. The next slideshow will introduce the capillary gate component, which explains hemodynamic physiology and complements the activity of the tissue repair component. Thanks for listening.